Everyone is aware of the risk of diabetes, but how many are aware that diabetes can lead to blindness? The condition called diabetic retinopathy is the leading cause of blindness in working-age adults, despite the fact that this blindness is completely preventable with annual screening and early diagnosis. The diabetic population is growing and growing. Today, less than half this population is getting screened because current manual screening cannot scale. Eyenuk aims to create the future of screening by fully automating this process with EyeArt, its first product.
We're super excited about technologies like EyeArt, which offer the opportunity for efficient, robust, automatic screening.
EyeArt is clinically validated on a large dataset, is CE marked, is protected by 4 issued patents, and is funded by prestigious NIH grants.
Well, it uses an artificial intelligence system that was trained using deep neural networks on 375,000 diabetic images. So basically you put in, this is a patient whose eye has, say, mild non-proliferative diabetic retinopathy or moderate or severe. These are different levels that we use, or proliferative diabetic retinopathy, and you train the system. This is deep learning. It was then tested on another 175,000 plus images to see how accurate it was. And then once that testing was done, we then said, okay, it's ready for use now in a clinical trial. So in the clinical trial, we compared it to the gold standard of these fundus photographs that were read by the Wisconsin Fundus Photograph Reading Center. So specifically what we did is we took 2 pictures without the patient being dilated. And these are of a certain size. They're 45-degree images. One is centered on the optic nerve, the other is centered on the macula. So 2 per eye. And then afterwards, we allowed the EyeArt system to interpret the image and say, is there or is there not this referable level of diabetic retinopathy? So it had to hit moderate NPDR specifically, or there had to be swelling of the retina, diabetic macular edema. If for some reason the EyeArt system could not read those images, then the patient underwent dilation and these images were repeated, sent again to the EyeArt system, and then, to see if it could read it. After that, the patient underwent dilation, if they hadn't already been dilated, and that was the vast majority, because the vast majority were readable. So after dilation, they then underwent 45-degree wide field images, 4 fields per eye. And these 4 images are equivalent to the standard 7-field ETDRS photographs, which have been used in multiple diabetic retinopathy staging studies. And we then compared the presence of moderate NPDR or CSDME between the 2 methods, the EyeArt system and the Wisconsin Fundus Photograph Reading Center results. Overall, there were 942 patients that were enrolled into the study. Of these, a total of 1,674 eyes had images that were gradable both by the EyeArt system and by the Fundus Photograph Reading Center. Of these 1,674 eyes, 1,364 eyes were negative for referable diabetic retinopathy. So now we specifically looked and saw how many of these did the EyeArt system correctly identify, using the reading center as the gold standard. And of these, that was 1,180 eyes were correctly identified as not having referable DR. There were 184 that were incorrectly identified as having referable DR. So when we looked at those eyes, we found out that the vast majority did have diabetic retinopathy, but at a very mild level, so didn't quite hit that level. And the others had other eye disease that was not diabetic retinopathy. So even though they were falsely positive, if you will, they still actually did have eye disease. Okay, so let's look at the other set. So of the 1,674 eyes in the study, 310 eyes were identified by the reading center as being positive for referable diabetic retinopathy. So looking at these 310, the EyeArt system correctly identified 296 of these eyes as having referable DR. There were 14, however, that it said did not have referable DR. So we looked closely at these eyes, and these were the false negative eyes, and they had very early stages of moderate NPDR, level 35 or lower. None of them had any higher levels. So the sensitivity of this system was actually 95.5%, that the EyeArt system correctly identified images as being referable DR if they truly had referable DR. And the specificity, that is correctly identifying them as not having referable DR when they did not have referable DR per the reading center, was 86%. And the images that were readable without dilation were actually 87% of the time. And for the eyes that then were later dilated in order for the EyeArt system to grade them, there were only a few eyes. The system functioned so well before that the sensitivity and specificity remained the same, whether you did it dilated or not.
The Diabetes Clinic Bad Mergentheim belongs to the Diabetes Center Mergentheim. We treat approximately 4,000 patients each year, mainly with the diagnosis of diabetes. Beside the Diabetes Clinic, we have the Diabetes Academy in our center, and we have an outpatient clinic with approximately 16,000 patient contacts each year. We have the complete amount of our patients who have a valid investigation of their eyes, and if the status says there is no diabetic retinopathy and no maculopathy, then they have the good feeling that there is no risk in the moment. Those patients in whom we see problems, we will send them to an ophthalmologist, and then they have the good feeling that a treatment can be initiated very early, and the earlier you begin, the better it's for the patients. I can recommend EyeArt without any restriction.